I am so excited you guys are all here tonight. I can talk all night, so I actually have my talk here to keep me on track. Yeah, especially when it comes to your pelvic health and your pelvic floor. Like there's such a taboo and such really unfortunately like a shame in our society placed on this part of our body that there's so much misinformation out there or flat out lack of information. I like to say, because I think this really exemplifies it. Like, how many words do we have to say ear, right? One. How many words do we have to say elbow? It's an elbow, but we could be here all night sharing slang words and code words and terms for our genitals. And it just shows how uncomfortable our society is that we have to have so many different ways to say it without saying it, right? And to take that even a little bit further, they have actually done research that shows that most people know the word penis and can accurately identify it on the human anatomy, but people don't know, most people, many people, I should say, not most, but many people don't know that the vagina, that term refers to the passageway from the uterus to the outside, right? What you're actually cleaning in the shower, what you're teaching your daughters to clean in the shower, your external genitalia is, or your pelvic floor is referred to as your vulva. Okay. So not your cookie, not your hoo-ha, like let's get that. And it's so important for us to use those terms. I remember when I have two little girls at home and my husband was very concerned when they were little. I'm like, okay, honey, we're going to be using proper terminology. And if you saw Kindergarten Cop, I'm totally aging myself, but Arnold Schwarzenegger, right? And like girls have vaginas and boys have penises, and they run around like screaming these terms. Like my kids never did that. They do that with swear words because I definitely made that a bad thing. So but like vulva like doesn't even phase them at all. So yeah, so this just shows how uncomfortable our society is with this part of our body. And what I like to tell my patients, and I'll tell you, you are the expert of your body. Okay. No one knows what you're experiencing and feeling in your body except you. And this whole life transition is really a stage of life where it's important that you not only get comfortable tuning into what your body is telling you, communicating with it properly and understanding what it's telling you, and then being able to advocate for yourself, being able to ask for help. And I find that hard because, if we haven't been talking about this part of our body and we've just kind of been ignoring it, just tuning into it is a step. And then understanding what it's telling us is the next step. And then really feeling empowered to say something and talk to people about it is even more. So you deserve to live your best life for the rest of your life. So I'm so glad you're here. Let's dive in. So there are a bunch of changes, a lot of changes that happen when you age. And Dr. Miller kind of started talking about that with us. We're going to dive even more into hormone therapy and specifics around that. What I'm going to talk about is perimenopause from a pelvic floor perspective, right? That's my wheelhouse. So in particular, I'm going to go over four things. Number one, what do we mean when we talk about the pelvic floor, right? And why should you care about it? Number two, what are some changes that happen during perimenopause and menopause and how that affects your pelvic floor? Number three, what are some symptoms you can be on the lookout for? And then four, what are things that you can do now to set yourself up for success? Okay. All right. Again, I could talk about this all day. We're going to keep it real top level here. But what we talk about when we're talking about the pelvic floor is, a group of muscles, ligaments, fascia, connective tissue that basically are lying between your legs. So this is a pelvis oriented, like I'm standing. This is the front. So where a bathing suit would cover, that is your pelvic floor. Okay. Now, even though there are arteries and veins and nerves and fascia and lymphatics, like so many structures in here, we typically refer to the pelvic floor as the muscles that attach from the pubic bone in the front to the tailbone in the back. And then from the ischial tuberosities or sit bones, so they're kind of what we sit on each side. Those are the kind of bony landmarks for our pelvic floor. And so all the red you see here are muscles. Now, super cool, fun extra fact, these guys are not pelvic floor muscles, but they are so closely related to the pelvic floor. It's called the obturator internus. They are actually a deep hip rotator. Yes, some people know about it. Yeah. And what's really cool, if you can see, is your levator ani, and I'll get into the layers, actually attaches onto the obturator right here. So yeah, deep hip rotators, obturator internus, and then piriformis is not on this model, but it comes in the back here. Those are deep hip rotators that are very closely associated and function with the pelvic floor. So the pelvic floor actually has 3 layers. So again, I'm not going to go over individual names for each of these, but they do have individual names. This first layer collectively is called the superficial genital muscles. You can see it's kind of this whole plane right here. Second layer is kind of like a little doorway, a little hallway in between the outside and the inside. And then the inside is really this bowl you see at the bottom of your body, and that's called your levator ani. So those are the deep pelvic floor. And you may hear it referred to as the pelvic bowl because it literally is a bowl, right? So the pelvic floor has 5 main jobs to do in the body. So we're going to run through those. Number 1, they act as sphincters. So I think most people understand that your pelvic floor muscles help you hold in pee, poop, and gas until you're ready to release it. Number 2, sexual function. Again, rhythmic contractions of the pelvic floor muscles are in part, lead to orgasm. So it's really closely tied with sexual function. Number 3, it acts as a sump pump, super not sexy, but very important because we're up against gravity all day, right? Everything wants to go down. So if we don't have that muscle pumping action, moving fluid and lymph out of that area, we would all be super uncomfortable and swollen down there. Not fun, right? So you don't see that online. Like you're not going to see people talk about that, but I'm kind of nerdy and I want it to be very complete for you all. So now you know. Number 4, support. Because of its orientation in the body, it literally just holds up everything above it. So basically all your abdominal contents, it's the bottom, it's the floor. And finally, and one of my favorites is its role as a trunk stabilizer. So with that, bring this guy back out again, it does not work in isolation. So we have pelvic floor muscles very closely working with diaphragm is the top of the box, deep abdominal muscles or transversus abdominis. And I'm doing this because if you think of my fingers, this is the fiber orientation running horizontally, and it literally goes all the way around. It's the only abdominal muscle that attaches to your back. Not directly muscle to muscle, but muscle to fascia and connective tissue, but that's okay. And then multifidus or little stabilizers in the back. So those 4 guys are the big guns when it comes to trunk stability. Okay, so you can see why your pelvic floor muscles are so closely tied to your quality of life, right? This is so important for keeping us comfortable, keeping us, active in society, and all these functions that they are involved in the body are just so important. So Dr. Miller talked about some of the changes that's happening in your body. I'm going to dive in a little more specifically about what happens in your pelvic floor as you approach menopause. So in general, your tissues thin and they dry out, right? I kind of jokingly say we wrinkle on the outside and we kind of wrinkle on the inside. Okay. We also your tissues don't hold as much water as they used to. They lose some elasticity in the tissues as well, and blood flow to your tissues. So, yay. Your muscle mass and strength also decreases, but really what we're learning and focusing on more now lately is power. But let me step back. And when we talk about muscle mass and strength decreases, we're talking about smooth muscle, which is the muscle that you have in your organs, right? And I think that it can attribute to some of the GI changes that we see. So these are the muscles in our body. They're just like on autopilot. You don't have to tell your stomach to digest, your bladder to expand, and but it also affects the decrease in strength and mass to the skeletal muscle. So those are the muscles that you do have conscious control over, that keep you upright and moving your body against gravity. So we talked about mass, strength, and power. Unless you have a consistent exercise routine after age 40, research shows us that you lose 1% of your muscle mass every year, up to 1% every year. Strength, you lose up to 2 to 4% every year. And power, you lose up to 6% every year if you're not doing anything to combat it, right? And so power is the ability to lift a weight quickly. So we have that speed component. We're working with different muscle fiber types, basically. And unfortunately, after age 60, all those percentages increase even more, okay? So the earliest you can get into an active lifestyle and do what you can, and we'll kind of talk more details and specifics around that, the better, right? But truly, until you're 100, until you stop breathing, like, you really can gain muscle, you can improve all of these things. It just takes more effort, right? Okay, so the decreased muscle mass, strength, and power affect your pelvic floor muscles. The general thinning, drying out, decreased elasticity and blood flow, that all affects the tissues of your vulva, vagina, and lower urinary tract. So we're looking at urethra up into the bladder. And Dr. Miller actually talked about the progressive chronic condition that's, we have this new term, is coined the genitourinary syndrome of menopause. And it's a good term. I think it's getting a little more recognized. And so you may start seeing it more online. And yeah, it's just a good one to know. So now I want to talk about how this can all manifest in your body and go over some of the symptoms that you can be on the lookout for. So I'm going through some of the symptoms on that genitourinary syndrome of menopause. This is not an all-inclusive list, right? I mean, and again, we're focusing on the pelvic floor, so I'm not listing hot flashes and night sweats and brain fog and all that stuff. So number one, vaginal dryness. Okay, what I want to put on your radar here is that vaginal dryness can also come from other causes. So potentially could be modifiable. So I'm not saying to stop what you're doing, but it could be a conversation that you can have with your healthcare provider. So your antihistamines, your decongestants, it dries up here, it also dries down there. So if you're routinely taking those, that may be something to stop if you're already experiencing vaginal dryness, or again, have that conversation. Calcium channel blockers, beta blockers, and benzodiazepines as well can cause vaginal dryness. Low dose birth control can do it. Obviously, estrogen inhibitors, right? If you have cancer. And then diabetes affects the small blood vessels, and that's what we have in our vagina and our vaginal walls. So that will also affect, and autoimmune conditions. So Sjogren's, multiple sclerosis, rheumatoid arthritis, things like that. Other fun symptoms we can think about and just be on the lookout for: painful sex, bleeding after sex, decreased sexual arousal, difficulty with orgasm, constipation, painful urination, urinary urgency and frequency. So urgency is when you're like, "Ooh, I got to go now." You have a strong urge that comes on. Frequency is having to go all the time. Like, you know where the bathrooms are and every place you frequent. Urinary incontinence is that involuntary loss of urine when you're not ready for it. And we break that into stress or urge, and then mixed would be both of those, to some extent. Stress is when you place a stress on your body. So you're coughing, laughing, jumping, running, things like that. Urge is when you feel the urge to go and you leak a little bit. We have a term called like the door and the key, or key in the door syndrome. Sorry, where you feel like you have to go to the bathroom. You're like, cool, I can make it. And then you get home and you're trying to get the key in the door and you're like, sorry. My bladder thinks that like we're at the bathroom, and I'm like I'm not even taking my pants down yet, so you have to, that's urge incontinence. Fecal incontinence, urinary tract infections, vaginal infections, and pelvic organ prolapse. Okay, so one of my big take homes today, that what I want you to understand about this stage of life, is that things that are, an inconvenience now are not necessarily going to get better on their own. Okay, when it comes to pelvic health, it's not of age of life where you're going to grow out of things. And we say, perimenopause is not puberty in reverse. So I think that a lot of us may have had that experience of, oh, this really sucks. I'm starting to get my period. I have acne. I have really heavy periods. And then at some point, maybe the periods get lighter and the acne goes away. It's like, okay, smooth sailing. My body got used to it. Not the case here. Okay. So issues that arise during this time can just magnify and get worse as you get older. So the urinary urgency and frequency can get worse. Not being able to hold your pee can progress to not being able to hold your poop. And feelings of vaginal heaviness or pressure can progress to, okay, more significant pelvic organ prolapse, where anything that's inside could come outside, right? And we don't want that. But what's super interesting, and again, what I want you all to understand, is that a lot of what you can experience in perimenopause and menopause can also come from pelvic floor dysfunction. So that list of things that I went through: painful sex, constipation, urgency and frequency, not even leaking, but just having to go pee all the time, can also come from pelvic floor muscle dysfunction. So, I work with younger women. I work with all ages of women, but women in their 20s who literally have all those symptoms, and they're not going through the hormonal shifts of an older woman. They literally just have tight pelvic floor muscles that is impeding all their organs functioning well and their pelvic floor functioning well. So yes, hormonal issues come into play at this stage of your life, absolutely, for sure. But things like tight pelvic floor muscles can compound the issues that you're already experiencing, and that's modifiable, right? That's something we can work on. And really, truly, to fully address an issue, you want to, as best as you can, get to the root cause, right? So if you're treating your issues as only hormonal, you may be missing a really key piece. Again, that's super modifiable. You can do something about. So any work that you do before or during perimenopause to understand your pelvic health and like your pelvic floor functioning is going to help you. And really, I would say setting up healthy habits is going to help you navigate through that time so much better. I mean, it's going to pay off in dividends. Okay. So there are five main areas of pelvic floor functioning that ideally, in an ideal world, you would all have an understanding of as you're going through this menopause or this perimenopause transition, right? Number one, pelvic floor muscle coordination. Do you know how to properly contract and relax your muscles? That's stage one, right? Number two, do you have any pelvic floor muscle tightness? So the concept here is that our muscles contract and relax like this. So you get down to the cellular level, there's this overlap in the tissues. They generate force and function because they shorten and they contract. They relax and they lengthen. If your muscles are too tight over time, you actually lose that building block length of muscle and they become short. So now, if you can see with this analogy, like my hands can't go anywhere, it's functionally weak, it can't generate force because it's already maximally shortened. So this is huge, and this is why I recommend seeing a pelvic PT, because if your muscles are tight, you're having the same symptoms as if they're weak. And we're going to talk about that. But tight muscles are weak muscles. You can't self-diagnose. You want to make sure you understand what is causing my leakage or my urinary frequency. Do I have tights or do I actually have weakness, right? Because we're going to treat them totally differently. Number three, pelvic floor strength. So you can, coordinate things well. You can confirm, okay, I don't have any tightness, and then you could actually be weak, right? So then the strengthening would come in, and only then. Kegels are not the answer to everything. We don't just do Kegels. Great. Number four, diaphragm control. We talked about that. Diaphragm is the top of the box because it's a closed system, right? Our lungs are here, and air comes in and out of our lungs. No air is coming in and out of our core and our trunk. So if you have restrictions here, or you don't know how to coordinate your diaphragm and take a deep diaphragmatic breath properly, or you're holding your breath all the time, or you can't coordinate your breathing with your pelvic floor correctly, then that is going to cause some disarray and that's going to affect your pelvic floor functioning. And then your habits, do you hold your breath or strain regularly? How are your postural habits? That is all going to affect your pelvic floor. And I'll give some of those tips at the end too. So we don't have to be perfect with our posture, but I just say, in general, we want to have good posture. So these five things are what you can expect to learn about your body if you see a pelvic floor physical therapist. Seeing a pelvic PT is my top recommendation. I may be a little biased with my life's work, but but really, truly, even one visit can confirm that you're doing great, and just give you some ideas of like, okay, how to move forward from here, or pick up on things before it's a big enough issue for you to even notice it, right? So that is like, we can pick up on, oh yeah, you're not really connected with your pelvic floor, but it's working on autopilot. So you're not leaking, you're not having pain, cool. But when I asked you to contract and relax, like it's not connecting consciously. And I see that all the time. And so we're, preventing issues, right? And it's awesome. And I truly encourage you not to wait until you start experiencing symptoms, because obviously it's easier to fix things, before there are bigger issues, right? But it's never too late, whenever you come in for pelvic PT, no judgment, no, it's always a good time. It's never too late. And as soon as you do, like that's ground zero, right? That from that point, you're going to be changing your pelvic health trajectory, your future in a positive way, like from that point forward. So in addition to learning more about your pelvic floor by seeing a pelvic PT, there are five things I want to leave you with right now that you can start doing to support your pelvic floor as you transition through perimenopause. And this is also important if you're already in menopause, right? So it's not just in the transition time. If you've stopped menstruating, you're past it, like you can still do all these things. Number one, and this is actually like 4 points. So take charge of your sexual health. Okay. You want to use a quality lubricant. I'm super passionate about this. We have slippery stuff samples in the back. Please all take one before you leave. Even if you don't think you need it or you don't want it, like save it for a rainy day. It's really good stuff. It's what I use clinically in the practice here. And so really when you're choosing a lube, just to educate you as well, you want to choose one that is glycerin free, water-based, especially if you're using silicone toys or anything. You want to have no parabens, phthalates, all the chemicals, right? Anything that makes it like heat or hot or like smell different, like that's all chemicals. Like we don't need it on our sensitive vaginal tissue, right? And then I think a lot of people know about pH, but the term I want to put on your radar, and sometimes you can't find this online, but I still want to teach you, it's called osmolality. So it is the rate at which something is going to give you water or take back water, right? So it's just like, it's this balance of water like osmosis. So our vaginal osmolality is right around 300. So KY, Astroglide, their osmolality is like 1,000, right? So what that means is it is drawing water out of your tissues. And we talked about your tissues are already drying out. They're already thinning, and that is going to make them more susceptible to micro tears and to like infections and stuff. So it's also going to keep you thinking, oh, I need more, I'm dry, and buy their product, right? So slippery stuff actually has an osmolality of like 23, 25. So if anything, that product is putting water back into your tissues, right? And it doesn't ball up. It's like, it's really good stuff. And then Good Clean Love, I think we're out of samples. There were just a few there at the beginning of the night. They are at an osmolality kind of close to the body's osmolality. So when I just look at the ingredients, I haven't tried that one personally. People rave about it. So we got samples and I want to put it out there because it is good osmolality, but it just has more ingredients in it. So I really like the slippery stuff. Number two, use a dilator. And I have ones to show. You can definitely, and this is a wand. So a wand is firmer. It's actually really firm. We've got a tapered end that could be vaginal. This could be rectal. This could be vaginal. But I mean, you obviously have to clean it, but either end can go at, anywhere you want. And then we have dilators, and dilators go in different sizes. So you can kind of see we've got really small, smaller than my pinky, and then we go up to really big. Now these do have some, this is Intimate Rose. And so there is some bend here. I like that it has a handle. There's another brand I like and I carry here. I don't have them up here for samples, but if you want to see it after, you totally can. It's really hard plastic, I guess it's plastic, but it's yeah, so it's not quite as bendy. This is a little softer and kind of gentler on you. But a dilator is basically a space occupying thing that you're going to put inside and to just stretch your muscles to help get that length back. And this is absolutely a use it or lose it kind of situation, right? So I educate even my older patients that say, oh, well, my partner died and I don't really want to be sexually active anymore. Or penetrative, I don't want any penetrative sex. I'm like, it's still important for you to use these to keep that mobility in the tissue. This part of our body is meant to be supple and flexible and stretchy. And besides just getting like pap smears or, well women visits, it really is important to have some mobility in these tissues for lifelong health. And again, going back to that, tight muscles or weak muscles, you'll see online, I think a lot of like, oh, if you have weak orgasms, put an egg up there, put some vaginal weights up there, squeeze, squeeze, squeeze. And it's like, no. So tight muscles, yes, weak muscles can lead to weak orgasms, but tight muscles can lead to weak orgasms as well. Number three, improve your sitting posture. So if you slump or slouch, no judgment, the judgment-free zone. I'm not looking at anyone. I'm off duty right now. But so if you slouch or you slump, what that does in your posture, it actually shortens your pelvic floor muscles. It puts this in a position where it's going to get your pelvic floor muscles shorter. And so that could lead to pelvic floor muscle tightness, and that affects things. But what it also does is it restricts blood flow to the clitoris, right? And the other part of orgasm is you have to get your clitoris engorged with blood. And so we already have decreased blood flow in this area. If you're slump sitting and slouching all the time or reclining up, then that's also going to keep blood not flowing well to this area. And we don't want that. And then number four is orgasm daily. So I know, and that doesn't mean partnered. That means you can take care of yourself. But I'm saying that's going to keep blood flowing to your clitoris, and that is going to have lifelong health benefits, right? Again, use it or lose it kind of thing. Number two, as far as like taking the 5 things to do now, is exercise in the morning. So this is for people if you already feel like you are experiencing any kind of pelvic organ prolapse or heaviness, then I would exercise in the morning. So that way your cortisol is highest, you're freshest. So any of those symptoms may be at their lowest. So that can be a really nice thing to kind of do. There's no way I could exercise in the morning because of getting up kids, so it just depends on your life. Exercising in general is better, even if you can't do it in the morning, but especially if you're symptomatic with some of that heaviness in your pelvic floor, then that's a good trick. And then number 3 is lift weights. So this is another thing. Definitely cardio is important, and lifting weights is so important. So this comes from, the power that we need to, the power kind of decreases. So we want to not only just lift weights, but we have to do it differently, right? So we want to be lifting as heavy of a weight as you can do comfortably and safely. All right. And what I tell people is like, you can't do what you've always done and get the same results at this stage of our life. And especially when you feel the weight gain and the resistance and all this, it's like we can't over exercise and under nourish our bodies and expect our body to be cool with that. It's just not. So we really got to dial in our stress management, fluids, good food, all that. But we really want to prioritize. So now when I go to the gym, I actually go lift first. So if I run out of time to do cardio, or I do 10 or 15 minutes of cardio, I do that at the end. I prioritize lifting the weights. Now, if you're not used to lifting weights, you're not just going to go and like clean or do this heavy squat, right? You can absolutely start with body weight. That is okay. But just realize at some point that body weight is going to get too easy. So then you want to add weight and you want to add more weight. And so you want to make sure that you're doing the little stuff to make sure your form is good and work with someone to make sure you're safe, but really want to keep pushing to lift as heavy as you can. And again, it's changing that mindset. You don't need to do 3 sets of 10 of every exercise, or 3 sets of 15 or 20. No, 1 set of 10, 1 set of 6 to 10 really is what we're teaching people now. And again, at this stage of your life, more bang for your buck. I'm not in there doing like single joint movements. We're talking compound movements. You get more full body, especially with your arms. You're not getting as much, they're just smaller muscles. So if you're going to do a squat and then a forward press, you're doing a whole body workout there. It's there and it's like, twice the work and half the time. And then again, thinking of the power, right? So we want to really, really, really focus on doing like, I see more people talking about jumping. There's a trampoline and vibration plate for like lymph flow, which is great. And actually vibration plates, there's been new research out and I need to dive into it more. So unfortunately, I can't speak to the parameters of like how fast you should put it and all that yet. But vibration plates have been shown to increase bone density. That and weighted vests are like 2 things that have really shown up in the research. So things to kind of be on the lookout for. But jumping rope, but more so like doing a kettlebell swing, right? Or slowly lowering down into a chair and then standing up as fast as you can, or actually doing a squat and then jumping up. So some of that explosive movement, some of that power, we really, really want to be working. Number 4, prevent constipation. This is another soapbox for me because if you look up online, one of my pet peeves, it'll say normal pooping frequency is 3 times a day to once every 3 days. No way, right? So, and I have had people come in, and I've learned this, and I teach all the doctors I work with. I'm like, don't ask your patients, are you constipated? Because someone will say no. Like their body's MO has just been all my life, I poop 3 times a week. That's not good, and that's not healthy, and that is not going to serve you through this life transition, right? So I vehemently say we should each be pooping at least once a day. Normal avoiding frequency is really, 30, you eat a meal, 30 minutes to an hour later, we should have a bowel movement, right? If all the stars are aligning, we're getting our fiber, managing our stress. Yeah. So if you're eating 3 meals a day, if you're fasting and you do 2, like cool too. But like, so bare minimum with my patients, I try to get everyone to at least poop once a day. And then we have a really cool scale, which I didn't bring here, but I have it in the other room, called the Bristol Stool Scale. Is genius. It's like a poop chart, and it just lets you communicate with your doctor without having to bring in a sample. Like, this is what my poop looks like. And you can kind of say, yeah, so we want the type 4, if you're going to look that up, on the Bristol Stool Scale once a day. So yeah, that's my thing. So there's, we can talk about, if you have questions about how to reduce constipation, we can go into that more deeply, but, or, detailed, but yeah, definitely getting on point with that and making sure as you go through, because things will naturally slow down, right? And then number 5, build your healthcare team, right? So get someone who's going to listen to you, someone who's going to help you with the nutrition and the lifestyle choices, and maybe the hormone piece, and then the pelvic PT. I mean, it's going to take a team. It's going to take more than one person to give you what you deserve to get in this life transition, right? It's okay to have support. So I wanted to, and then the vaginal estrogen, I have to say, like, if people come to me first before being put on that, I absolutely send them out and recommend they get the vaginal estrogen. Hormone therapy is outside of my scope of practice, but topical estrogen is safe, and I absolutely ask everyone to be on it. So when you come to me and you have like the urgency and the frequency, yes, it can be some of the things I can help with, but it also can be, helping the health of the tissue at that level with the estrogen, like locally. So awesome. So thank you so much for coming tonight.